In this video, we will cover all 26 bones that make up your foot and all of the major bony landmarks that you need to know for your upcoming exam. We will cover all the important joints that make up your hindfoot, midfoot, and forefoot. Whether you're a beginner or an advanced anatomy student, there is something here for you. To begin, here's a brief overview of all the bones in the foot. Our first one here is the talus, which is the bone that interacts with the tibia and the fibula to form the talocrural joint or our ankle joint. Beneath that, we have the calcaneus, also known as our heel bone. If we go medially, we have a navicular bone, which is located right here. Going a little laterally, we have the cuboid on the lateral side of the foot. And then we have three cuneiforms. We have a medial cuneiform, intermediate cuneiform, and lateral cuneiform. Distally, we have the metatarsals. So these are metatarsals 1, metatarsal 2, 3, 4, and 5. Moving even more distally, we have the phalanges. And so every toe has three components except for the big toe. Typically, there'll be a proximal phalanx, a middle phalanx, and a distal phalanx, and that applies for toes 2 through 5. Now, the big toe only has one middle joint right here, and it has a proximal phalanx and a distal phalanx. The hindfoot has two main bones and is the main weight-bearing surface of the actual foot, as it does take all the weight of the entire body as we walk and stand and go about our day. Our first bone here is the talus, and so we're going to zoom in on the talus here, and we have a couple bony prominences that we want to be aware of. So right here is the talar head right here. This is the head of the talus, and if you go back, if there's a head, there's always a neck, which sits right beneath the dome, and this is the talar dome right here, this smooth surface, right? Also known as the trochlea of the talus, and this again sits right in that tibia and fibular notch right there that's formed with our two leg bones up here to form the talocrural joint, which main motions are dorsiflexion and plantar flexion of the ankle to maintain stability of our ankle joint. Moving down to the calcaneus, we have a couple bony prominences as well. This one along the medial side is very important. It's called the sustentaculum tali. This is Latin for shelf, and it does really look like a shelf kind of supporting the talus here. An important thing about the sustentaculum tali is there is a groove underneath it right here where an important tendon lies, and this is the tendon of the flexor hallucis longus, which comes down from the leg, courses right under there to go flex that big toe as its main job. So that is important, that tendon runs right under the sustentaculum tali. In the posterior aspect of the calcaneus, you have the big portion right here called the calcaneal tuberosity. Again, tuberosity just meaning a big bony prominence, all right? And then over here we just have a medial and a lateral process of this entire tuberosity. If we flip the foot over to the lateral side, we have an important structure that's kind of like a cave almost, and that is right here. Right here, this is called the sinus tarsi. And this is a gap kind of in between the talus and the calcaneus, sits right in the joint space of the subtalar joint, which is located right here. The subtalar joint is really that main joint that is interaction between the talus and the calcaneus, and is the joint that produces inversion and eversion in the ankle. This sinus tarsi is pretty important because the ATFL, the anterior talofibular ligament, sits very close to this and provides a lot of proprioceptive input. With lateral ankle sprains, especially if they're severe and you get a tear or something in the ATFL, which is the most common sprained ligament in the entire body, there could be some pain, residual pain deficits, balance deficits, proprioceptive deficits, and so this could be a pain source in some patients. The midfoot has 5 bones, and its primary responsibility is for shock absorption while we're running and walking. And this midfoot, all these joints here are surprisingly mobile, and they deform and form in ways that provide stability and flexibility to the entire foot complex. It has 5 bones, and particularly want to draw attention to this line right here. This is called the transverse tarsal joint right here. This is the joint that connects the hindfoot to the midfoot. Now, the transverse tarsal joint is a name for 2 different joints, okay? Our first one here is between the talus and the navicular, called the talonavicular joint, and then the next one is on the lateral side from the calcaneus to the cuboid, known as the calcaneocuboid joint. Our first bone here that we want to be aware of is along the medial side, called the navicular, and the navicular has one important bony prominence down here on the medial side called the navicular tuberosity, right there. If we flip the foot over laterally, we have our cuboid, and our cuboid also has a couple important pieces. We have a cuboid tuberosity as well. In addition, we have another tunnel almost, and this kind of groove right here. And this groove, and we can look at it on the bottom of the foot, and this groove right here is specifically for the tendon of the fibularis longus. And that, if we remember from our muscle video, the fibularis longus comes this way, courses along the medial malleolus, and sends a tendon through that groove of the cuboid to go and attach at the bottom side of that foot over here. to mainly produce eversion. And that is important that that groove right there is specifically for that tendon, which is really cool. And then our cuneiforms don't really have too many important bony prominences, but we got to know what they are. So again, along the medial side of the foot, we have the medial cuneiform, the intermediate cuneiform is in the middle, and then we have the lateral cuneiform to provide stability there. The forefoot has 19 different bones and is commonly known as our toes, basically. And its main job is for propulsion, so pushing off during the walking phase, or if we are running and sprinting, we need to be able to push off, and that is the musculature that is responsible and the joints that are responsible for this in our forefoot. So an important joint that we need to be aware of is this line that forms between the midfoot and the forefoot, which is right along this ridge here. And this right here is called the tarso-metatarsal joint. It makes sense. These are our tarsals, and here's our metatarsal. So tarso-metatarsal joint. And this gets us into our metatarsals. And so we have a couple important pieces here. Again, there are 5 of them. And on each of them, there's the same. We start approximately as the base. So right here is the base. And then we have the body of the metatarsal. And then going here is our head of the metatarsal. And that applies, that's the same bony prominence for metatarsals 1, 2, 3, 4, and 5. And there's one more important piece that we need to be aware of on the lateral side of the foot is on our 5th metatarsal specifically. This is the tuberosity of the 5th metatarsal. Again, this is where our fibularis brevis and closely our fibularis tertius nearly attaches. And so it's an important bony prominence that we should be aware of as well. As we continue to move distally, we have another set of joints here, and this interaction between the metatarsals right here and the phalanges is the MTP joints right here, and these are the metatarsal phalangeal joints. And if we keep on going, we have a couple bones in each of our toes that are very important to know. Each of our toes has 3 distinct bones except for the big toe, and we'll take this one for example. We have the proximal phalanx, a middle phalanx, and a distal phalanx, and that applies for toes 2, 3, 4, and 5, except for the big toe. The big toe only has 2 bones because it only has 1 joint there, the interphalangeal joint right here, and this has a proximal phalanx and a distal phalanx. Now the other toes, they have 2 different joints. They have this one right here called the proximal interphalangeal joint, and then this one over here called the distal interphalangeal joint. Additionally, there are again the same naming system as the metatarsals up here. They're just smaller. So we have a base of the proximal phalanx, the body, and the head of the proximal phalanx, and that applies to every single phalanx in here. It just gets smaller and smaller as you go distally. And those are all 26 bones of the foot that provide stability to the foot, provide mobility for us, and help us be functional every single day of our lives, which is really amazing. I hope you learned something today. I hope you were able to take something away and really master all those bony landmarks. Please feel free to check out more videos just like this on the channel. Thank you so much for watching. I am the PT Guy, educating you on God's wonderful creations. I'll see you in the next one.